you nearsighted? Are you farsighted? Maybe you're having astigmatism. Dr. Yaghouti is here to get us back in focus. And, Doctor, it is good to have you back.
Good to see you.
You know, because, as you know, because I've been to see you.
Right.
We have tested my eyes and taken a look to see which are, and I'm everything. I happen to be nearsighted, farsighted, and I have astigmatism in both eyes.
In both eyes, correct.
Yeah. So how can I see? You know?
Very good question. And you mentioned all three of them. So commonly when people start getting glasses, they start at a younger age, and there are several different types of refractive errors, we call it, where it's myopia or nearsighted, which is a common term, hyperopia or farsighted, which is another common term,
right,
and then astigmatism. And astigmatism is one of those beasts that people just don't understand.
Well, there's different. They're different.
They're different. They are.
Yeah,
different.
I have to admit.
There are different presentations and different ways that people see. So people who are farsighted.
Now, if somebody's seeing like this.
Right. So this is someone with astigmatism. The astigmatism creates a distortion in their vision, so you can see how the window itself is distorted, and they can't see near, they can't see far.
Right. That's I have that especially in the left eye.
In the left eye, correct.
Yeah.
And the other pictures we had before, one showed that they could not see distance, but they can see near, and that's someone who is nearsighted. Correct.
Right. This
and
is
here they can see
nearsighted.
near. They can't see distance, and those are the folks that start wearing glasses to try and see distance vision. And
right,
then you have farsightedness, where they can see distance for most of their life,
right
before the age of 40, but they can't see near. But in those cases, they also start changing as they get close to 40, where their distance and near starts going. So
right. Well, that's happened to me. I went bi in my 40s, my late 40s, bifocal. I had to start wearing bifocals, which really messed me up at the beginning. I was tripping downstairs. That was very difficult.
That's right. So I have a model here to kind of show you how the different things work in terms of nearsightedness, farsightedness, and someone with astigmatism. So people who are nearsighted, what happens is when light comes into their eye, the light actually focuses right over here. It does not focus all the way to the back where it needs to go. So it undercuts in terms of where it should be.
Why is that?
It could be for two reasons. It could be that the eye itself is longer, just genetically, or the curve in the front is steeper, and that causes the light, when it bends, to only bend closer than it needs to go.
All right.
And with those folks, what we do with surgeons, we actually change the shape of the cornea, which is over here, this membrane out here, and cause the light to bend back here. In terms of nearsightedness, it can start at early age, at the age of 1 month or even 2 years, and that's congenital myopia, or it can start as late as 20 to 30 years of age.
So you can correct all of this, including an astigmatism.
Including astigmatism. Now, astigmatism, it's one of those things that can be associated with nearsighted as well as farsighted. And what happens is that your eye is almost shaped like a football, and that's the kind of terminology everyone says. And it could be the shape of the front of the cornea or the eye. And when light comes into the eye, it actually focuses into 2 points. It focuses from here, over here, as well as from here, out here. And so because you have 2 different points, you have 2 different types of vision, and so that's why you get the distortion that you get with astigmatism.
Now, outside of wearing contacts, which I have done, right, you can, with the Lasik surgery, correct nearsighted, farsighted. Can we do both yet to one person?
You can do. There are some people that do present with nearsightedness in one eye, farsightedness in the other eye.
Well, that's the monovision.
Well,
right? Or is that different?
That's different. So we're talking about people before the age of 40 that really have the need for glasses to either see distance or near. When you get to 40 and plus, then you start dealing with people who have problems that start getting age-related changes in the lens inside the eye. And those folks, then we have to do monovision or treatment for presbyopia. So that's the age-related change in the eye.
All right, okay. So, and in our ensuing visits, we will get to all of those things.
Right, and unfortunately now, with the lasers that we have, we can actually do a greater parameter of treatment in terms of the prescriptions.
All right, well, there you go. It's global laser vision. I'm coming over tomorrow.
Very good.
We're working on my monovision, right?
Monovision.
We'll talk about that as I go along. Thank you, Dr. Yaghouti.
You're welcome.
All right.